All right, good afternoon, good morning, whatever time it is where you are. Thank you for joining. Welcome to today's webinar, Public Policy and Employer Support to Improve Family Health and Well-Being. This webinar is part 2 of a series in honor of Work and Family Month and is sponsored by NIOSH's Total Worker Health Program and the NORA Healthy Work Design Cross-Sector Council. On behalf of both groups, we're delighted to have you all with us today. So my name is Carolyn Winslow, and I will be the moderator for today's session. I am a member of the NORA Healthy Work Design and Wellbeing Cross-Sector Council and external chair of the working group managing Objective 7, which focuses on promoting a sustainable work-non-work interface. And it's my pleasure to be here with you today. So free continuing education credits are available for this presentation through the CDC's Training and Continuing Education online system. We are pleased to offer the following continuing education types, which are listed on your screen. Detailed instructions for accessing the CDC TRAIN site are available for download at the website listed at the top of your screen. That is www.train.org/CDC TRAIN. And please note that the blue activity number is only valid for those watching a live webinar. You will need the course access code to receive credit. And the gray activity number is to be used only for those who view the webinar recording or attempt to access CEUs after December 2nd, 2024. We are recording this webinar and plan to post it on the Total Worker Health webinar page as soon as possible for those who couldn't join us today. So as mentioned, the NORA Healthy Work Design Cross-Sector Council is a co-sponsor of this webinar. The council focuses on protecting and advancing worker safety, health, and well-being by improving the design of work, management practices, and the physical and psychosocial work environment. The Total Worker Health Program is another sponsor for today's webinar. And put simply, if you're not already aware, the Total Worker Health approach is about keeping workers safe, plus establishing programs, policies, and practices to cultivate greater worker well-being. Just briefly, the Total Worker Health Program recently released its vision for the third decade, suggesting research and job protections extend to all workers regardless of industry, occupation, job title, individual or social factors, demographics, or employment arrangement. And more information can be found in this link, which perhaps someone can put in the chat since it's a little small there. Okay, so now to our featured presenters. We are delighted to have Drs. Kimberly French and Dr. Julia Goodman for 2 special presentations. So I'd like to briefly introduce both before we get to their presentations. So Dr. French is an assistant professor in the Department of Psychology at Colorado State University. She earned her PhD in Industrial Organizational Psychology from University of South Florida and her MS in Industrial Organizational Psychology from California State University, San Bernardino. Her research focuses on how managing work and family affects the health and well-being of individuals and their family members. Her work is published in outlets such as Psychological Bulletin, Journal of Applied Psychology, Journal of Occupational Health Psychology, and is supported by funding from the National Science Foundation and the National Institutes for Occupational Safety and Health and Centers for Disease Control. Dr. Goodman is an associate professor in the OHSU PSU School of Public Health, where her research examines inequities attributed to work-related social determinants of health among pregnant people. Through her interdisciplinary research, she explores how work-related policies, such as paid family leave, impact health and health equity, as well as potential spillover into the broader workplace. She draws on multiple methods to conduct timely, policy-relevant research that informs ongoing policy discussions. She holds a PhD in health policy and MPH in maternal and child health, both from UC Berkeley. Her undergraduate degree is from McGill University in Montreal. And so as far as the format today, each speaker will have about 20 minutes, followed by a 15-minute Q&A that I will moderate at the end of both presentations. So Drs. French and Goodman, welcome. And Dr. French, we will start with your presentation. Over to you.
Awesome. Thank you so much, Carolyn, for that introduction. I'm Kim French. As Carolyn mentioned, I'm an assistant professor in the psychology department at Colorado State University. And so I'm excited to be talking with all of you today about some of the research that we have on what supporting workers' work and family needs looks like. And I'm going to be talking specifically about a couple of different particular occupations, in addition to sort of the general research that we have. So first, within the work and family field, one of the things that we talk most about is work-family conflict. And this is an experience that's familiar to many, if not all of us, right? We have two major domains that we're involved in. We are workers, employees, and we're also family members. But sometimes, those two roles come in conflict with one another, such that they make it really difficult to be as effective as we want to be in both domains. And this can happen in two specific directions, right? Work can interfere with family. So, maybe you have a big deadline coming up, and so you have to stay late from work, and so you miss, dinner with your family that evening. Alternatively, family can interfere with work. So maybe, your toddler throws a giant tantrum before you leave in the morning, and that puts you in sort of a negative headspace as you come into work. And it's sort of difficult to focus on your job. And so work can interfere with family, and family can interfere with work in lots of different ways, right? In terms of time, in terms of energy, in terms of emotions, even in terms of behavior, right? So acting in ways that are appropriate for work, but with our family. And we've got decades of research on work-family conflict, lots and lots of research showing that work-family conflict is generally experienced as negative, right? So it has negative implications for our family and career success, for our health and well-being. And there's some recent data from the APA that also suggests that work and family are major stressors in our lives. So this is from a recent survey put out by the APA in 2023, looking at pre and post-pandemic levels of stress. And what we see is that stress kind of increased for everyone from pre to post pandemic, but particularly for parents, right? We see an accentuated increase where parents report sort of being the most stressed out and appear to have the sort of largest increase across that pandemic period. If we dig deeper into parent stressors, we also see that work and finances are a major source of stress. So feeling worried about money, feeling worried about work, are really important for parents. When we also look at data, this is data collected by the McKinsey company, we see that work-family issues are also major barriers for employment, right? So things like childcare expenses, wanting to spend more time with family, having caregiving burdens, these are all major reasons why folks leave the workforce, and particularly women tend to leave the workforce. So we see not only from sort of academic research, but also from these sort of larger surveys, population surveys, that work-family issues are a major thing that affects how we feel and our success at work. And so naturally, the question that we come to is, how can we best support people so that they can manage their work and family needs and improve ultimately their health and well-being? And so there's a couple of different levers that we tend to talk about in the broader organizational psychology field. One of them is control, right? So we know that control is really important for helping people to feel like they can manage their work and family responsibilities. In the work-family field, we typically talk about flex place. So this is being able to change where you work, and flex time. So being able to change when you work. We can also talk about control in terms of autonomy over work tasks and the kinds of things that you're doing. This is actually less discussed within the work-family realm. Typically, we talk about flex place and flex time, but autonomy over work tasks, there is a little bit of research showing that being able to change what you're doing is also helpful for helping you feel fulfilled at work and therefore fulfilled in family. Now, a second major lever that we talk about is support. And when we talk about supports, often we think about formal supports. So family-friendly policies, things like paid leave, maternity leave, paternity leave, healthcare, dependent care supports. Also flexibility, formal flexibility supports can fall in here, but we can also think about informal supports, right? So being able to talk about, your family issues, at work, so you can better problem solve, kind of how to balance the two, or being able to talk about work with family, right? So that you can, again, sort of either let those emotions out or get some instrumental support and guidance. And, I think in work family, these lines are actually a little bit blurred. And so when we talk about support, we're actually talking about control at the same time. Again, many times we think about, for example, flex place and flex time as different forms of support, right? And the reason why they're effective is because they're perceived as supportive. And likewise, I think when we talk about supportive behaviors, a lot of those actually enable employees control, right? That's how we're supportive, is we allow employees control and autonomy. So I think while we think about these two different sort of categories of resources for workers, in reality, especially in work family, they're really very much so interlocked and interchangeable. So we're going to talk a little bit first about family-friendly policies and what we know about policies and their effectiveness. Now, when I'm talking about family-friendly policies, I am thinking somewhat broadly. So this is some data we have from like a family, was it the Working Parents 2023 National Trends Report? And so we can see here, some of these policies are offered more often than others. So things like paid time off, flexible hours, healthcare tend to be offered pretty often for folks. Other benefits, particularly benefits for parents, so having childcare assistance, having backup childcare, paternity leave, maternity leave, these things tend to be less frequently offered to workers. And this is particularly true for smaller companies. I think this gap is sort of interesting in and of itself, as we just saw from that APA data. Perhaps it's working parents that really need supports most of all, and yet the supports that are most typically offered are sort of broad and not really targeted to parents, whereas those parent supports are less often offered. So right there, an interesting sort of intervention gap. We have a number of encouraging results about family-friendly policies. We know that when people have family-friendly policies, they tend to be more satisfied with their jobs. They tend to be more committed. They're less likely to turn over. There's a small relationship there with performance. And of course, they engender feelings of support and autonomy. Something really interesting about policies that I think not a lot of folks know, if you're not in this research, is that access to policies is actually more strongly associated with these positive outcomes than actually using the policies, right? So just having the policies available seems to be more important for attitudes and well-being than actually using the policy. And I think there's a couple of reasons for this. I think when we talk about policy use, we start getting into some more complicated issues that we'll actually talk about in just a second of, is that use going to backfire on me? Are people going to look at me differently because I'm using the policy? Policy use also depends on, the extent to which my supervisor is really supportive of that. Use also depends on, my family situation and whether that is actually a good match for what I have going on at home. So there's a lot of caveats to use that I think make them overall less effective than just having the policy available, right? Having the policy available is generally a clear signal that the organization is supportive. Now, some sort of caveats to put on those great results is that these effect sizes are small. So the meta-analyses that we have looking at the relationship, for example, between family-friendly policies and work-family conflict show that we're only explaining about 1% of the variability in work-family conflict with these policies. So that is pretty small. It's there, but it's small. And again, there's sort of no consistent effects because there are a lot of caveats in how employees are using them, the extent to which family and work are supportive of those policies and the way the employee wants to use them. And so it's hard to sort of have an overall overarching positive result there. Right? It really depends. And then there's also some ugly associated with family policies. The big one is sort of unequal access, and this has been talked about many times in a variety of different ways, right? We know that countries, for example, have different policies around mandated leave and paid leave. We know that organizations have different policies. Even within organizations, certain workers might have access while others don't. For example, we know that lower wage jobs tend to have limited access. Gig workers and contract work have limited access because those folks aren't sort of the typical salaried workers. And so especially with our economy growing in terms of gig work, this becomes an issue where, like, sure, we have these policies, but there's a large segment of the workforce that can't actually use or access those policies. And of course, there's issues of, benefit communication and, the supervisors really being the gatekeepers, right? Those policies are only effective to the extent that employees know that they're there, and that they are encouraged and supported in using those policies. There's also some policies that are actually associated with negative attitudes. And so we've seen this a little bit recently. For example, this study right here that came out looked at egg freezing policies, and they compared egg freezing policies to other kinds of work family friendly policies. And what we see is that compared to our sort of typical work family friendly policies, egg freezing is actually viewed as, the organization asking you to sacrifice your personal life, asking you to prioritize your work. It's viewed as more costly than other policies, and it's viewed as having less actual benefit to employees than other policies. And so ultimately, those egg freezing policies are associated with less support and organizational traction than other policies that organizations might offer. And some recent work that we've been doing is on abortion facilitated policies and gender affirming care policies. And so we've been comparing these to reproductive care policies and cancer treatment policies with the same kind of basic question, like, how are employees viewing these policies? And, is it possible that there's sort of differences here depending on how niche the population is that the policy is serving and how politically contentious that benefit is? And we do find that even among political liberals, folks rate gender affirming care and abortion facilitated policies less positively, as less important, and as less useful than other kinds of health and family policies. And those differences are accentuated among political conservatives. So again, certainly some great results for family-friendly benefits. However, people might not necessarily view all benefits similarly, and some benefits, depending on kind of the content of the benefit and depending on the person, might actually be viewed in a negative light. We can also then talk about informal support. So by informal supports, I mean psychological or material resources that are provided through social relationships. So again, these are things like being emotionally supportive, so being open to talking through emotions or feelings or stresses, as well as instrumental support. So actually problem solving, providing resources for employees, and helping them to sort of figure out solutions. And the good here is that we see that this informal support is associated with less work-family conflict, more positive attitudes, better well-being, productivity, autonomy, motivation, family well-being, lots of great outcomes associated with informal supports. Another great thing is that these effects tend to be about 2 to 3 times the size that we're seeing for formal supports, right? So more effective by 2 to 3 times magnitude. And so if we want a lever to pull, right, that informal support lever, building a supportive culture, training supportive supervisors is probably the lever that we want to pull first. We also did a meta-analysis on this topic, and we found that this was true around the globe across, different jobs, and it was especially true in national cultures where support is really needed. There is some bad associated with informal support. So something that we have to be aware of is supporter fatigue. And so we don't want to place all the burden on one particular individual, and we want to make sure that we support individuals. A particular source of support that's talked about a lot is supervisors. And shout out to Leslie Hammer and Ellen Cossack, who has done a number of great studies and work in this area on how to train supervisors and give them kind of the supports and knowledge and tools that they need in order to be able to help support their workforce. We also know supporter ostracism is a thing. So if if supervisors are not supportive, they can be ostracized by workers, right? So there's some sort of backlash if you are not supportive. And there's also potential backlash for employees who try and use support or give support, right? It might be perceived as providing special treatment to those employees, or employees might be stigmatized for using accommodations or trying to negotiate supportive arrangements with their supervisor. So these are things that we do have to watch for, make sure that we have the correct training in place, make sure that we have the proper culture in place, and make sure that we have good communication and transparency when we're being supportive. This is again data from that another APA survey, right? Just showing a little bit about, sometimes not all workplaces are supportive. So for example, we see office work, right? That time off, that's support for having time off tends to be higher in office work than manual labor. So again, I think pointing to a really important practice gap here where we can make a difference and start to sort of target the kinds of jobs we tend to see less supportive cultures. Similarly, we see in micromanaged environments, right? People tend to feel especially stressed out. So again, hinting at, a place or a type of occupation or workplace where we might want to sort of target for supportive interventions. All right, I'm going to take now like a little bit of a closer look into what it means to be supportive. And here again, we've got lots of research, especially led by folks doing research on family supportive supervisor behaviors. So one thing that I do like to highlight when I talk about support is that this is sort of a two-way street, right? Relationships are multiple people are in a relationship. So this is not all on the supervisor. There's a role for employees here as well. So supervisors can certainly, be creative in helping people to manage their work family needs. They can work with employees and make sure that they are communicating clearly, consistently about sort of both the expectations of the supervisor and in negotiating with employees about potential creative solutions. It's important for both parties in this exchange to really be flexible, right? Sometimes the supervisor can't always give on something that the employee would like to help them manage work and family, but maybe there's something else that we can do, right? Or maybe, we can have some time off now, but not always. Oh my gosh, I have 1 minute. I was going to get a 5-minute. Sorry, Carolyn. Okay. Okay. So we can have clear expectations, show compassion, and have good boundaries. I'm going to skip through this. The important thing here, I will note, is that for remote workers, really for any workers, having a designated workspace is actually really important. We learned this coming out of the pandemic, especially. So do not work in your bed. Make sure that you have a sort of clean, appropriate workspace, no matter where that work is. I guess I'll conclude by just talking a little bit about how this looks for shift workers. And this is based on some work that I did earlier in my career. We just came out with a measure of flex time for shift workers. For shift workers, support looks like having control, consistency, and predictability. And shout out here especially to Susan Lambert, who's done a lot of research in this area. Again, this is sort of a two-way street in helping to have that consistency. So employees can help by really planning ahead, by trying to make those requests for schedule accommodations early. Of course, that's not always possible, but to the extent it's possible, I'm trying to really plan ahead. Requesting that schedule stability and having those conversations with managers to make sure that you have a stable schedule that you can plan around. And of course, working with others to try and switch shifts. Supervisors, on the other hand, can make sure that they are publishing those schedules in advance to provide that consistency, predictability, making sure that you try to keep shifts as consistent as possible. And then the last thing that kind of emerged in our research here was the importance of that family supportive culture, right? So in shift work, this looked like not punishing workers who tried to have control, right? So making sure that you don't give them poorer shifts because they asked, for an accommodation, right? Give them the same shifts, right? Don't hold that against them. And similarly, coworkers, right? Working and having compassion for one another when there needed to be a schedule shift, a shift change rather. We found that actually, not sort of punishing people for trying to have control was in many cases a stronger predictor of well-being and family outcomes than the shift control itself. So it's really important to have that positive environment. Okay, I imagine I'm done now. So I'm going to go ahead and pass this off to oh my gosh, to Julia and skip through all of my slides. Oh, whoop, there you go.
Thank you so much. So thanks for inviting me to be part of this panel. I'm really excited to be here. I am coming to this panel, from where I sit in the School of Public Health, and we are really increasingly focused on social determinants of health. We talk a lot about social determinants of health, and employment is consistently listed among other social determinants of health. But I would argue that employment is often sort of considered as a binary, is somebody employed or not, or as a subset of economic security when we're thinking about it as a social determinant of health, and not as the really complex social and economic phenomenon that it is, and that I think Dr. French just did a really nice job of illustrating. So I'm so excited to be part of this panel because I know this is a community, this is an audience that really understands that and really thinks about work in a more nuanced way. In my talk, I'm gonna, I think, both go narrower and broader than what Dr. French just shared, in that I'm gonna focus specifically on the period around pregnancy and postpartum as sort of a critical period for health, and broader in that I'm gonna focus on public policies specifically and really not talk as much about what's happening within organizations. So, as most of you are probably aware, the US is in the middle of a maternal and infant health crisis. We have much higher infant and maternal mortality rates than most of our peer countries. Um, and even worse, we have really shocking and unacceptable racial inequities in maternal mortality, where we can see that Black birthing people have more than twice the rate of maternal mortality than their white counterparts. We also see higher rates of preterm birth than almost all other high income countries, and this contributes to those higher rates of infant mortality as well. And again, you can see that we have really troubling racial and ethnic inequities in preterm birth as well. Now, there's lots of different reasons for these inequities, including structural racism, toxic stress, inequitable access to healthcare, and lots of other factors that are really important. But arguably, one factor that contributes to this and that I think gets a little bit less attention is the role of work. So clearly, most work is or can be perfectly safe, even during the perinatal period. And in fact, most women work during pregnancy. Among women who are giving birth for the first time, about 2/3 were employed during pregnancy. And among these, 86% were employed full time. But again, as this audience knows, all work is not the same. And so we really need to think about the work conditions, or sort of how we work, as potentially being important here. In the US, we have a range of federal, state, and local policies and laws that are meant to protect pregnant workers, but these laws are arguably incomplete and they're not consistently enforced. This powerful New York Times investigation from back in 2018 reported that many women who are working in strenuous jobs lost their pregnancies when their employers denied their requests for light duty, often even ignoring doctors' notes indicating that this was necessary. So when we layer a sort of racialized occupational segregation onto poor enforcement of this patchwork of legal protections, I think we can start to see how work might play a role in these inequitable birth outcomes that I just shared. One thing to note also is that in the US, women tend to work very close to childbirth, both during pregnancy and in the postpartum period. So more than 80% of women who worked during pregnancy worked until the last month of pregnancy. And most women return to work relatively soon after birth, with a majority of women in the US coming back to work within 3 or 4 months postpartum. You can compare this to other peer countries where the average duration of maternity leave is much longer. In the prenatal period, as I sort of suggested in the previous slide, pregnant workers really need access to accommodations at work that would enable them to continue working safely and comfortably. And the recent passage of the Pregnant Workers Fairness Act is intended to support this goal. And hopefully we'll start to see that there's a positive impact on on conditions during pregnancy. But in cases where accommodations are not feasible or are not enough, and then certainly when we're thinking about the time closer to childbirth and in the postpartum period, we really need to be thinking about access to paid family and medical leave as a really critical support. And this is the kind of public policy area that I'm going to spend the most time focusing on in this talk. So there's a lot of research that has looked at the relationship between paid leave and a range of health, labor force attachment, and other measures of well-being. I would argue that this literature is not perfect, but overall, the body of evidence is strong enough that several major medical organizations like the American College of Obstetricians and Gynecologists and the American Academy of Pediatrics have recommended some period of paid leave in the US. However, as you may be familiar, despite all of this evidence and the support of various organizations, the US remains a global outlier in this domain. We're one of the only countries in the world that doesn't guarantee any paid leave for new mothers. In much of the world, and particularly when you look at Europe, 6 to 12 months, of paid leave is commonplace. And by the way, this is also the case for fathers and other non-birth parents in many parts of the world. Slowly, here in the US, states have begun to implement paid family and medical leave laws to help provide a floor of paid leave access. So there are now 9 states, plus the District of Columbia, that have passed and fully implemented their paid family and medical leave laws, and another 4 have passed laws more recently, but those haven't yet been fully implemented, and that they're not yet distributing benefits to folks. So as more and more states consider passing paid leave laws, and hopefully we inch kind of closer and closer to a federal law, I think it's really important that we keep in mind some of the challenges that we've seen through the research, particularly with respect to implementing effective and equitable paid family and medical leave laws. So first, while some employers offer paid leave voluntarily, not all do, and access to employer-provided leave is highly inequitable. So this is from a paper that I did with my colleague Will Dow at UC Berkeley and Dawn Richardson here in the School of Public Health. And we used data from the American Time Use Survey leave module to look at self-reported access to paid family and medical leave from one's job. So we look separately at medical leave, which is leave to care for your own serious health condition, leave to care for a seriously ill family member or caregiving leave, and parental leave, which is leave to care for a new, care for or bond with a new child. And across the board, we saw that Black and Hispanic workers were significantly less likely to report that they had access to paid leave. Now, when paid leave is offered by employers, we see that it is highly valued, and sort of echoing what Dr. French shared just a few moments ago, but the impact and experience of leave taking really depends on characteristics of the workplace. We did some qualitative work with a paid leave policy that was implemented in a county health department, in a county employer a couple of years ago. And we found that supervisor support didn't necessarily change whether employees take leave, but it had a really big impact on how people feel about the leave taking experience. And so specifically, we found that supervisor support led to feelings of enhanced trust, empathy for your supervisor or your coworkers, earlier planning of leave, and a whole range of other positive outcomes that are really important both to employees and to their employers. And I think this really highlights that simply offering paid leave, while important, is not enough. And we need to also be attending to the organizational culture to really ensure that employees feel supported in that experience. So finally, even in places that have passed paid family medical leave laws, we see 2 key barriers that remain. Not everybody is covered by the laws that have been passed, and not everyone who's covered is using the benefits that are available to them. And both of these are directly tied to how those policies are designed and being implemented. I'll illustrate this point with a study that I worked on a couple of years ago, again with Will Dow at UC Berkeley, where we looked at the impact of the San Francisco Paid Parental Leave Ordinance, which provides 6 weeks of fully paid parental leave to new parents who are employed in San Francisco. And we conducted, as part of the study, a survey of new mothers who we sampled from birth certificates, and we were using Medicaid coverage of the birth as a proxy for income to really try to understand who was being impacted by this policy. So the left side of this graph shows that most women and their partners, regardless of income level, were employed at the time of birth. However, on the right, you can see that among employed workers, lower income women and their partners were less likely to work in jobs that were covered by the ordinance. So specifically here, they were less likely to work for a private sector firm with at least 20 employees and to meet the minimum job tenure and hours requirements to be eligible. At the same time, people who are eligible may not be aware of the benefits available to them or to understand what they entail. So again, using examples from our study in San Francisco, we found that Black and Hispanic women, as shown on the left here, as well as women who are working in leisure and hospitality industries in the right, were significantly less likely to report understanding their maternity leave benefits. And really critically here, they were less likely to report that they received help understanding their benefits from their employers or anybody else. We also saw similar disparities in knowledge and awareness when we looked by income level. So for state paid leave policies, unlike the San Francisco policy that provided full wage replacement, an additional barrier is that most of the state programs don't provide full wage replacement. So lower wage workers face an additional barrier in that they may not be able to afford using the paid leave programs that they're eligible for. So what should we do about this? How can we enable equitable access to paid family medical leave so that we can better support pregnant people? In terms of policy design and implementation, we need to think about policies that are as expansive and comprehensive as possible. And what I mean there is expansive in that they cover everyone or as close to everyone as possible, and there are minimal carve-outs. And comprehensive in that the benefits provided are fully paid, job-protected leave, and leave that's at least 12 weeks, and arguably significantly longer than that. It's also really critical that these programs, as they're passed and implemented at the state and potentially federal or local levels, build in money for outreach, including outreach that is built on partnerships with community-based and culturally specific organizations. And this is really important that those organizations are enabled and to kind of reach out to their constituents and make sure that this information about state level programs is available and accessible, and people understand that these programs are actually for them. And then, this has come up over and over again in conversations with state paid leave program administrators and advocates, is just that navigating program websites and filling out the paperwork is really complicated. And so it's important that we're creating simple, easy to navigate websites and forms that are available in multiple languages to make the application process easier. In terms of employers, I'm not going to go too deep here because I think Dr. French spent a lot of time on this in the last presentation. But we really need to make sure that employers have access to information. That employers are providing employees with information about their paid leave benefits, not only the employer provided benefits, but also publicly provided benefits where available. So folks in states where there's a state paid family medical leave program, employers have a responsibility to also provide information to their employees about those laws. And then certainly demonstrating a commitment to supporting workers who have caregiving responsibilities, including modeling leave taking. And another shout out to Leslie Hammer and Ellen Kosick here for their work on family supportive supervisor behaviors and how important the supervisor role is. And I'm really excited that there's a kind of new iteration of this that's specifically focusing on family supportive supervisor behaviors related to leave taking. So I'm really excited to see what we learn about that role. So finally, I think there's really an important role for health systems and healthcare providers. And this is an area I'm especially interested in because I think that there's a really great opportunity here that is currently being missed. So health systems increasingly recognize the importance of identifying and addressing health-related social needs, which are sort of the downstream results of social determinants of health. And sorry, I lost my cursor here. And employment and income, of course, are included here, are often thought of as a health-related social need. We've seen that providers want to support patients' work-related social needs specifically, but because, as I mentioned at the top, this is received less attention than other social needs, providers often don't have the tools that they need to be able to support workers. We conducted a systematic review a couple of years ago that found that screening for employment-related social risk factors is not regularly occurring in prenatal care specifically, and the tools that are available don't assess the multidimensional nature of work. So they were more often focused just on whether or not somebody was employed, which, I would argue, especially when it comes to the period of pregnancy, is really not enough to understand what's going on and be able to support people. For their part, patients also really want support navigating work and pregnancy. We did a study of people who had recently given birth and were employed during their pregnancy. And these were all low income or precarious workers. And they shared that there were 4 primary areas where they really wanted support from their providers. They wanted help completing paperwork that was needed to apply for paid leave benefits and receive work modifications. They wanted help, they wanted their providers to provide information about how to mitigate employment-related risks and how to apply for paid leave benefits. They wanted referrals for social and medical services that could be helpful based on their specific job characteristics. And then finally, they wanted their providers to advocate for patients to make sure that they were receiving accommodations, resources, and information. So to help bring this all together, I want to draw on the recent Surgeon General's report on the mental health and well-being of parents. And this report, which was just issued in August of this year, really sounds the alarm bells about the pressures that parents in the US face and the toll that it's taking on their mental health and well-being. Now, this report underscores the importance of the perinatal period in particular for women's mental health. And they note that approximately 1 in 8 mothers experience postpartum depressive symptoms with a disproportionate impact on women of color. The report also notes that in order to support the mental health of parents, we need to ensure that all parents can get paid time off to be with a new baby or a sick child, secure affordable childcare when they need it, and have access to reliable mental health care for themselves and their children. And I think really importantly, the report calls to action policymakers, employers, community orgs, health and social services, a whole range of different actors. And to me, this really highlights how the challenges that parents face are complex and multidimensional. And paid leave is a really important part of this, but it's also just sort of one part of a broader set of policy and systems changes that we need to enact if we're serious about supporting working parents. So this is a big challenge, and there's clearly a role that I think NIOSH and this community can play here because of the deeper understanding and the deeper thinking about the role of work and how our work is organized in ways that may need to be shifted in order to really support working parents and other caregivers. So I just want to thank these great funders and collaborators on the project and on the projects that I described here, and looking forward to questions.
Great. Well, thank you both so much for these very useful and informative presentations on such important topics. We really appreciate you taking the time to share your expertise with us today. And so now with that, we will transition to the Q&A portion. So as a reminder, please use the Q&A box to submit questions and direct questions to specific speakers as applicable. Looks like we already have a few questions, so let's just get right into it. I think the first question might be directed toward Dr. French because it came up during her presentation, and that is a question surrounding how can we achieve compassion among coworkers? I think this was perhaps asked in relation to the slide showing how reactions differed by benefit and political affiliation. Again, the question is, how can we achieve compassion among coworkers?
Yeah, this is a really great question. And I think, I think in one sense it's sort of hard, right? Because we're talking about individual differences to some extent, which are hard to change and which people sort of come into the workplace with. But I do think that the workplace is a context that can shape the extent to which those, personality traits or individuals manifest. And actually, Dr. Goodman, she referred to this a little bit in her presentation, right? The organization's culture and really role modeling and setting expectations, I think, is really important here. So, if there are policies in place that are family friendly, right, and compassionate towards personal needs, if supervisors are, demonstrating compassionate behaviors and making that the norm in their work team, I think that then helps others to be more empathetic and compassionate, right? If that is the norm, if that is the culture, I think that can bring that out in other folks as well. And we know that the situation is a strong determinant of the extent to which those individual differences shine and how they shine. And so really working to create the policies and practices from leadership that demonstrate compassion, I think, is where we can build that compassion in everyone in the workplace.
Thank you. The next question we have is for Dr. Goodman. So it says, although some family leave policies are designed in a way that both men and women can request to use them, there are gender differences in the intention to use and also consequences of using such family leave benefits. I wonder if you could share your thoughts on how we can ensure gender equity in the design and implementation of family leave policy.
Yeah, thanks. That's a great question. I think in terms of the actual policy design, some things that research has shown are really important for getting fathers to take leave are having fully paid leave. So men are much less likely to take leave when it's not fully paid, whereas a lot of women, and especially if it's somebody who has experienced the pregnancy and given birth, are going to take leave regardless of whether there's pay, at least some period of leave. And so the difference is more in terms of the impact that it might have on them and the length of leave. So certainly designing policies that are fully paid is really important. In other countries, in the US, we have a perfectly gender equitable paid leave policy, and that we have 0 weeks of paid leave for anybody, which of course is not what we want to see. Outside the US, in places where there's much more generous paid leave policies, there's a real range. There are some policies that are completely that are available to mothers and fathers in the same way. But increasingly what we've seen in some countries that are trying to encourage fathers to take that leave, because usually when there's a period that can be used by either parent, the birth parent or the mother is usually taking most of that time. So another policy design feature that we can think about is having some period of paid leave that is not transferable, that can only be used by the father. And, part of that is just trying to incentivize fathers to take leave. And that is, one step towards trying to normalize leave taking, because I think, similar to Kim's answer to the last question, I think a lot of this then comes down to the stigma that people experience when they take leave. Also inequitable wages, where if in most partnerships men are making more money than their partners, then it also is sort of a financial decision that skews towards moms taking longer periods of leave. So I think there's a lot of things that we can do, and that other countries that have really generous paid leave policies are starting to do. in both the policy and kind of organizational levels.
Great, thank you for that. It looks like we have a comment, maybe not a question per se. If you have a question, please enter it into the box. But in the meantime, I will read this comment. So related to Dr. Goodman's presentation, the Community Preventive Services Task Force is currently overseeing a community guide systematic review on the effectiveness of paid parental leave on health outcomes. The Community Guide program is partnering with NIOSH on this review. So perhaps just something that might be of interest to folks.
That's great to hear.
Yeah. And we do have another question for Dr. French. What are some organizational or government policies for addressing work-family issues you would highlight for precarious or low-income workers that are levers that may offset the financial and job security issues around taking leave for these workers?
It's a really big question. It's a really big question. I mean, I think you know, having wage policies, right, that provide like a livable wage, having policies around, you know, consistent hours, right? Again, if we're thinking about shift workers, and we're thinking about like, you know, gig workers, any kind of precarious work, like the question doesn't become like, how can I work less, right? It really becomes like, how can I work consistently so that I make sure that I have a consistent paycheck so I can pay my bills every week, right? So it's about providing a livable wage. It's about guaranteeing like a minimum number of hours for those workers so that they know that every week they're going to at least have like a certain amount coming in. And it's about being really predictable in what hours they're sort of asked to work, or giving them sort of control over their work hours. So I'd say any policies around minimum wage, any policies around, you know, minimum number of hours, either at, you know, government levels or at the organization level, are helpful for making sure they have consistent income and predictable hours so they know what they can depend on each and every week.
Can I just add quickly to
Yeah.
that too? I think you talked earlier about gig workers as being a really important sector that are, you know, they're often excluded from these policies, and this is a growing group of workers. And I think that's really an important point, in that, you know, a lot of the precarious workers are working in informal jobs, in gig jobs, you know, however it may be defined. But in any case, they're usually excluded from these sorts of protections. And that's something that we really need to think about if we're serious about supporting lower wage and precarious workers, is making sure that all of those workers are getting the protections that other workers do.
That's true, right? So like, you know, there are like, you know, legislature and court cases around like, you know, our Uber drivers, contract workers, or like, and so those are actually really important conversations that ultimately affect, you know, the kinds of benefits that they might have access to. So I do think, yeah, it boils down to like almost very just basic sort of work legislation, work policy of just like having a wage, a predictable wage, and making sure that worker classifications, to your point, right, also afford different supports, or that workers are classified in a way where they can access supports.
Great, fantastic. Thank you both. There is another question here. Looks like it's for Dr. Goodman. And it reads, PFML may increase the cost of employers for hiring women, especially those with high probability of giving birth, assuming that is a reference to age. What do you think might be some unintentional drawback of paid family medical leave, and how can policymakers intervene these potential problems?
Yeah, I mean, this is a question that comes up a lot. And I think one thing that we can do is, and one thing I guess that's important to note about the state paid leave policies that currently exist and that are being considered, are overwhelmingly, or among those that exist, they are all paid family and medical leave policies, which means they're not just maternity leave. They are for other parents and caregivers. They are for caring for a sick family member, for your, you know, your parent, your child, your sibling. They're for your own serious medical condition. Like these are covering the range of leaves that all humans experience at some point in their work lives. And I think that's really important to emphasize, that these are not policies that are only going to be used by people who are giving birth. I mean, in my presentation, I was really emphasizing that period in particular because it's so critical. And I think the needs are especially acute, but these policies are not designed only for pregnant people. So that's something that I think is really important to highlight and is important in our policies in the US, that the state policies that do exist, they really are covering all kinds of leave, and that's important. That said, I mentioned the study that we did of San Francisco's policy, which is focusing specifically on new parents. It's not only mothers though, it's for fathers, it's for not just for birth, it's for adoptions and fostering as well. So again, sort of expanding who is covered by these policies. But even with San Francisco's policy, which is parental leave and is different from state policies in that it has an employer mandate where employers have to actually pay for part of the leave available so that workers are getting their full wages. And we did another part of that study was a survey of employers, and we found overwhelming support for the policy from employers. There was confusion and there was some difficulty in actually complying with the law and understanding exactly what employers needed to do, but people really were supportive of this kind of policy. So, I think this isn't as big of a problem as people often make it out to be. I think the bigger problem is that people often feel like they can't use the benefits, they can't take advantage of the benefits, as opposed to it being a huge cost.
And then finally, just a friendly suggestion to connect with us on the Total Worker Health website, also social media. And there's a newsletter, an e-newsletter, Total Worker Health in Action. If you don't already receive that, we invite you to sign up so that you receive information. So again, thank you all so much. We really appreciate it. I know I learned a lot, and
Thank you.